Scott, it's great to meet you. Thank you for hopping on today for the Ripple Effect with Ray. I'm excited to get to know more about options. And can you tell me a little bit more about why you started?
Oh my gosh, thank you. This is so fun to talk to you this morning, and I love to share our stories. I had a pretty lengthy career in nursing and healthcare here in Phoenix. I graduated from nursing school in 1986 when it wasn't real cool for guys to go to nursing school. So it was kind of but I've always been a little different trailblazer in my own mind. I've always wanted to kind of carve out my own thing. Fast forward 20 years almost, and the job I had was I was interacting and engaging with patients that were often affected with symptoms of dementia, Rachel, and a lot of that can, as you know, can also have like psychiatric component to it, where they've got depression, anxiety, their nights and days are mixed up. There could be even some distortions of reality and paranoias and perceptual difficulties. So I was the eyes and ears for the physicians, and and I really enjoyed that part of it. I love to be kind of in that clinical space, in people's homes, kind of problem solving what was going on with them. And a lot of those homes were already, for some of those people, in senior living. I didn't know anything about senior living, assisted living, independent living, memory care communities. That I didn't know any real backstory to it. But the owners of some of these small private residential places were asking for help in bringing them new residents. And so I asked my boss about it one day. I said, "Hey, what they're offering me money? How do I get paid for guiding people or being a coach or a guide for these people and get them into the right situation?" She said, "That's a violation of a federal law as a paid employee for a licensed home health agency paid by Medicare. That would be a federal offense. So don't do that." So remember, I wanted to be my own guy. So I was like, well, how do I do that? And there was a new industry arising here in Phoenix, this senior referral and placement industry. And so I literally quit my job 2 weeks later and started a company to go do my own thing, to guide people and use that clinical, that professional, and I had it blended with, I wanted to be self-determining. I really was frustrated working for somebody else all those years, that I wanted to, at 40 years old at that point in time, wanted to do my own thing. So that's a long answer, but I wanted to do my own thing and I wanted to make a difference. That's it.
Absolutely. And I love that kind of the cogs in the wheel clicked for you at that time to say, hey, here's a need.
Mm-hmm.
These seniors that need placements. And I'm
Mm-hmm.
sure it's so sensitive for families to have to figure out, oh, where is it going to be best for, my mother or my relative or whatnot. So tell me a little bit about, what options does
Yeah.
for
Real simply, we're a guidance service for families that helps them locate and secure the right long-term care solution for a loved one. Our services are totally paid for by the receiving facilities. We have contracts with hundreds and literally hundreds and hundreds of senior living operators in the greater Phoenix area. That's all prearranged. We're not biased. We just take what families tell us, help them create a game plan, prioritize their needs to the top, and then guide families to expose the various options that meet their objectives and priorities. We walk them through it just like a realtor would show up at a house and walk people through a house. We literally meet people. We go through those senior living operations with them. We guide the conversations, ask all the right questions, help them negotiate the right situations, and then actually bring other resources in that they may need, like a real estate professional, like an attorney to get their powers of attorney done properly, any funding issues with public benefits. We bring all the resources to the table in addition to the guidance service, so that a family gets a comprehensive experience with us and walk them through it, and it's free to them. There's no service, there's no charge to them. They're not paying extra with the facilities that we choose. It's all covered under what we do.
Yeah, and I'm sure that alleviates so much stress on the family on trying to figure out what's the best fit. What major shifts have you been seeing or noticing in the industry right now?
Yeah, this is an unregulated and unlicensed space. There's very little regulation around the nation. it's really state by state. There's no federal oversight to what this placement industry has become. So I say that to say there's now been a national movement. I was fortunate enough to have a part in that, to create a national association and an organization that establishes best practices, a bar, a professional bar and code of ethics, and a certification program for us. So with everybody wanting to have their own business and they're looking for low and no barrier to entry to get into, we're seeing a massive influx of people that are unqualified, inexperienced, very transactional in their approach to helping families. We get paid a referral fee, which is a percentage and maybe even 100% of the first month's rent. So any particular transaction could be $3,000 to $10,000. So it sounds like a lot of money. Well, you got all these people that are attracted to that. And so we have this now influx of professionals. I'm not against competition or the influx, but then there has to be some training, there has to be some education, some guidance towards those national best practices and some other training programs that are now, and that's part of my personal mission, is to help educate those folks that are coming into the space, because families are vulnerable, the seniors are vulnerable, people are in crisis a lot of times, Rachel. And so when you get people that are posing to be experts and they really don't know what they don't know, they can do a lot of damage.
I can imagine. And I can imagine that impacting probably the way you run business, no?
Oh, absolutely. I have been sold out for 15 years on this mission to raise the bar and become seen as a professional industry. Remember, we were a bunch of rogues in a band. They used to call us bounty hunters and body brokers in Phoenix. Okay.
Okay.
As a professional, I was a nurse with a really stellar career. I didn't like that. I didn't like to be seen as less than or the necessary evil. So my mission has been to work to elevate the industry, and of course then my business has to match that. I can't say this and do that. My business has to be. And now that my adult children work for me, I have to be even more transparent. So I'm constantly working towards the bar of being a standard setter locally, now nationally, I believe, for the work we're doing, so that people that are offering this kind of guidance and work down in the trenches with families that are in pain and stress, we want to be really, really good at it. As a side note, 20 years ago when I started, my mom was 62. She was my age. Well, now she's 83 and she's in assisted living. And now to actually be the adult child with all the heaves and hoes and the emotional dancing and there's such a drain on us, my wife and I, emotionally, on what mom's needs are as we navigate our own families and our own businesses and still have mom. That's one of my responsibilities. Those of us that are in that space, that sandwich generation we've heard about for years, right? It's for real. I'm one of, like, I got 4 generations: mom, me, my kids, and my grandkids that I'm balancing. So it's a lot for this age group right now.
What do you feel like has been working well? What's been a little bit more frustrating?
There are times for Scott, I even need, with all my experience, I need a third person, not one of my brothers. Sometimes it's one of my brothers, but sometimes I need an outside party to help me with my own mom locally. I know all the right ways to go, but mom's an individual that doesn't want to hear it from her adult son. She doesn't. Most parents don't want to hear it from their kids. They don't like the role exchange that's happening. It's really happening all over the nation. People my age are having to step into that loving leader guide for our parents, but our parents aren't necessarily loving the exchange or receiving. They're not. Many of them are they are the survivors of the last of the Depression and the World War II kids. So they're a really proud, hard, strong generation of people that just don't want to hear it. So I have to get some help at times. It's fair to say to adults that might be listening to this, if you're an adult child and you've got a parent, do ask for help. Call before the crisis. get support. There's a lot of us out there. There's a lot of us out here that are connecting to each other for that support. We have a private Facebook group here in Phoenix, Rachel, that we started called the Aging Parent Tribe. And it's just hundreds of adults that are in there going, oh my gosh, I can't do this another day. But it's a place where privately people could come in, get support, get redirected to the right resources, but feel like, hey, they're not on an island. And so it's super important for families to hear from other families and know that there's resources to be had, there's help to be had. The issues surrounding their aging parent or parents don't have to run their life entirely.
Exactly. It's the reassurance that they're not alone, that they have support
Yep.
around them. There's resources, that there's other people that are in the same boat, in those same shoes,
Yeah.
and that they don't have to navigate this all by themselves. Because I know plenty of people that have felt that feeling of like overwhelm and stress. And when it comes to transition, it comes to options
Mm-hmm.
specifically, which metrics would you say you're most focused on improving?
Oh, wow. Great question. I think the most important thing is that not all assisted or all senior living is for everyone. So I spend a lot of my time teaching my daughters who now work for us, and in my coaching and consulting work I do with others, that the assessment, the intake, that first meeting, gathering as much information so that you can make an informed recommendation or sets of recommendations for the right placement. So the two parts of it is doing the deep dive on the intake part, but it's also knowing the senior living operators more than just the ones that are on the corner. There's such a variation in services and personalities and categories of care that go on inside those communities, to be able to take all that deep information you've gathered from the family and the prospective resident and matching it to the right place is a very different process than just knowing that there's 15 places in the same zip code that you're looking for, and you let all the people in the zip code know that you've got a senior, where you just now kind of blast out to everybody. And then, do you really get the best fit if you're just looking at geography? Are you really getting the right care needs met? There's a lot of that transactional outcomes approach and outcomes that are happening with people like me because they don't know the providers as well, and they don't do a deep enough dive on and that's because I was a clinician. So I was a nurse that asked people hard and deep questions. So I'm trying to teach non-clinical people a lot of the same things. So that's the thing. Get more information and know your product, know who you represent on the other side, so that you get the right match.
Absolutely. So the education and the knowledge is what I'm hearing you say.
It's critical. And so I don't know, it was probably about 7 or 8 years ago. We were meeting as a team. My team at that time had about 9 or 10 of us. We're now a team of four. Just let you know, we're just a family business. I don't say just, but it's my wife and our two daughters. But at one time, I had 9 or 10 of us on the team, and we were we were working on, like most companies do, like a mission and vision statement. And we
Mhm.
came up with some things for us that we still hold true today. And I believe that we identify ourselves as educators, advocates, and experts in the resources of our community. Educators. So options for senior living and in the options companies, we're going to be dedicated to educating all families to be prepared for what's coming down the pipe for their loved ones and for their own aging process. All right. I mean, I'm getting older too, right? And so it's just not mom, it's me. And I wanted to be a resource to help people be prepared for the long-term care and the aging journey, right? So part of that mission has been to do that with families around town. Now part of that mission is nationally with my boot camp program. As you see in the back, the boot camp is a basic training program for aspiring entrepreneurs and professionals that maybe want to do this kind of work, right? And they don't have any basis, or they've got a little inkling, so I take them through a 16-hour, 8-module basic training program to help educate them and lift them into a new business for themselves, and help inspire them to do it well, and to pursue those national best practices that I had a hand in writing. So it all works together for me, that issue of education and then advocacy for our industry, advocacy for the seniors. That's making sure that me and my team know the best senior living operators in town. It's not just hey, here's the closest 3 to you, let's look at those, but to match their care needs to the right. It's advocating for families to make sure they get the best outcomes, and that's really, the thrust of what we're trying to do: educate and advocate.
Absolutely. I love that. And I love that you're even trying to spread the word through your digital advocacy as well, and training and making sure that people are well equipped to handle what's to come. Where do you hope to be in the next 6, 12 months, couple years?
Our youngest daughter was the first of our kids to come to work for us, and she just had her first anniversary, and we did her annual review yesterday, actually, and it was like really, really very inspiring for me to be able to pour my life's work into one of my kids. And now her older sister left her career as a school teacher, and Molly's 3 months in, and Molly and I are going to do her 90-day review next week. And so a year from now, I want to be able to see the growth of my own kids as professionals impacting other families. They're going to learn how to run the business and be the legacy, so that their mom and our good work continues on into another generation, and it's run by our kids. And so that's I guess my number one thing. This boot camp is taken off. I've got, I don't know, 7 or 8 people signed up for my next class. There's people from all over the nation that want to get into this space. They see the opportunity, they see the business and the opportunity for impact. It's a great blend of 2 missions. And so to be an influence for, several dozen people this year, and I expect to double that impact next year. I was inspired years ago by my mentor and best buddy to leave people better than you found them. Just simple.
Yeah.
Just leave people better than you found them. And I've just tried to run my business that way. And whether it's the professionals that you engage with, that they're better because they knew you and I was an advocate for their business, or whether it's the families down at the level of their kitchen table, trying to talk to them and being in their presence, and they're telling you about their stress and their pain, and to watch their shoulders go, oh, relief. That's why you do it at that level. You know what I mean? And so Scott just wants to be that guy that, honestly, it's not cliche for me. I've been doing this, I've been out of school for 4 decades. So this is my thing. It's my thing. That's my track record, is to be in a place where you're making a difference.
I love that, Scott. It's so beautiful. I can even see just the energy, the passion, the emotion that you hold when it comes to the work you're doing, and it's truly
Yeah.
so inspiring and
Thank you.
beautiful to witness, share,
Thank you.
and you. Thank you so much for hopping on here with me today, Scott. Really excited to see what our audience has to say, and hopefully they come to you, and
Yeah.
the legacy continues, the ripple effect
Thank you.
continues.
Thank you. If anybody has any questions, you just want to chat, or wherever you are, I'm part of a pretty large national network. And so when people sometimes ask me, Rachel, hey, I need some help in Boca Raton, Florida, or Houston, Texas, anybody? I often do. So my website is optionsforseniorliving.com. There's a connect or contact me button there, of course. The phone number is a local number. It's 602-845-1320. But man, I just field calls. If you got that pain in your life with your loved one, hey, you're not alone. Reach out. If you need some help guiding you to the right person, if you have questions here in the greater Phoenix area, obviously we're here for you.
Thank you.
You bet. Thanks for having me today.